exercise specialist with the Lifestyle Center at Alamance Regional Medical Center. I work with the cardiac pulmonary oncology rehabs, and today I'm going to be doing a presentation on exercise and cancer prevention. I hope you enjoy and have a good day. According to the latest numbers that the American Cancer Society has, there's around 12 million cases diagnosed in 2007. That's all different types of cancer. Breast, colon, endometrial, which is ovarian cancer, prostate, and lung cancers, those are typically the most prevalent out of all of those cancers that there are. Those are usually the ones that get diagnosed. They're finding out that exercise is helping prevent cancer. That's why we're here talking about exercise. It is here doing that. However, the one thing that pretty much all the studies that have been conducted, the one thing that they're finding is they can't figure out what the exact mechanism is of the exercise to help prevent cancer. Now, they think it may have something to do with hormones, chemical levels, some chemistry in your body that happens with exercise. Management of other chronic diseases, exercise is helping with that, and by managing those other chronic diseases, diabetes, heart disease, any kind of lung disease, things like that, that's also helping reduce the risk of picking up a cancer as you age with one of those chronic diseases that you may have. Okay? There's some more risk factors here we got to make sure that we're assessing and modifying if need be. Number one, obesity, we said. Number 2 and 3 here, age and gender. Obviously, we can't fix those. You're stuck with what you got, okay? But as we age, again, the tendency for chronic disease does go up. It's an inherent fact. You can't do anything about it. But we can change some of these other controllable risk factors to help curb the effects of that. The fourth one here, environmental exposures. Anything that you can think of. Things, shipyards, asbestos, people, builders and things. They were exposed to all those. Dust. All sorts of dust from all sorts of job descriptions. I'm sure you could probably fill in the blanks if you're not good, but things like that. Another one we can't change here, genetics, family history. Still haven't figured out how to choose your mom and dad, but if I do, we'll see if we can get everybody healthy. The more you know about your lineage and what your predecessors had, grandparents, great-grandparents, cousins, anybody. Tobacco and alcohol abuse, harp on that all day. That's one we need to cut out. Radiation exposure. I'm starting to understand what radiation can do to a body, and we have certain measures that we take, even here at the hospital. Certain measures we take to limit that. Sunlight can be another one. Another one that we're starting to come around to realize how much damage sunlight can do. Tanning beds. They put a tax on tanning beds, I think this year or last year or sometime like that. They can be very, very dangerous. Skin cancer, again, another prevalent cancer. The next one here, psychological stress. That could be depression. It could just be bad stress that you have. Maybe family puts it upon you. State of mind has a big part to play with your physical health. And then last one, poor diet. We know about that one, fast food. And I know the convenience is there, but again, that's another one of those risk factors we want to try to modify if need be. Now we need to figure out how to modify. Okay, we've identified what we've got, and now we're wanting to change some of those. We need to make a plan. We want to establish our short-term, long-term goals that you want to strive for. Okay, we have a lot of people come in at all our rehabs, cardiac rehab, especially cardiac rehab, and they are going to quit smoking, quit eating fast food, start eating salads every day, and we're going to start exercising 5 days a week. That lasts for about 2 minutes. One change at a time. Make them so they stick. If you need to, get help from a friend, healthcare professional. We have all sorts of services here at the hospital. We offer a whole lot, and we want to make sure that you receive that individualized attention so that you can succeed, because that's what we're here for. All right? Never hesitate for help. Now, I'm going to focus on exercise. And the first thing you need to do is you got to establish where you're at with your current levels of exercise and physical activity. All right? Physical activity. Any bodily movement that produces energy expenditure from muscle and muscle group. Okay? So that's anything we do throughout the day. That can be mowing the yard, gardening, weed eating, raking leaves, doing the dishes, all of those things. Whatever you're doing to move. Okay? Exercise, on the other hand, is bodily movement that is planned, structured, and repetitive for an extended period of time, and you have some target in mind. One thing that we do, and we just started doing it, and we're getting really, really good feedback about it, we do exercise testing over in our department, over in our fitness center. We have a young lady that does that. She's another exercise physiologist, and she does that by appointment, and it's about, I think, $75, if I'm not mistaken. It's called Fitness Map. And what she can do is do a series of fitness testing, some assessments on you, and then she'll come up with an exercise prescription for you. And I don't know if any other facilities in the community do that kind of testing, but we do have that there. And we also tell everybody, we want everybody to know that when you come see us, you're not just coming to see a trainer. You're coming to see somebody that has a background on the chronic diseases and knows about your medications and all those things, and we can help make sure that your prescription is appropriate for you. There's 3 types of exercise that we need to be working on. Number 1 is aerobic exercise, which is what most everybody named a minute ago. They did a lot of walking. That's always a good one. Swimming, jogging, biking. Those are all good ones. Next one, resistive exercise, and the third is flexibility and balance training. Okay, the aerobic exercise, sometimes referred to as cardiovascular exercise. It's all the same thing, just different ways to refer to it. And it incorporates progressively overloading the heart and lungs, and also the large muscle groups that you have in your body with extended periods of time, moderate to vigorous exercise intensity, repetitive. Okay, so basically what that means is you're hopping on a treadmill and going for 30 or 45 minutes, okay, or getting on another piece of equipment. There's bukus of equipment that you can get on. Also, you can take it outside. Like I said, running, jogging, biking, swimming, all those things, whatever you have access to or are able to do, those are good exercises to be able to perform good aerobic exercise, okay? And it's recommended 3 to 5 days at least. If you can work in a 6th day, that's always good. Always leave yourself 1 day of rest, okay? And we want to be trying to work on at least 30 minutes a day. 20 minutes, very, very minimum. 30 minutes a day, that's a good place to start. If you can hang with that for a month or so, then maybe try to go up to 35 or 40 minutes. If there's things you like to do, you've got to make sure that you're doing those. Don't do things just because somebody stood up here in front of you and told you you need to be walking every day. Okay? Make sure it's something fun that you enjoy, and incorporate a partner. Get a buddy, spouse, somebody like that to go with you. It makes it much more enjoyable to have somebody there with you exercising, hold you accountable to the exercise. If somebody's waiting on you to go exercise, probably going to be more likely to go ahead and hop up out of bed and go exercise with them that day. So make sure you're taking all those things into account with aerobic exercise. The next thing, resistive exercise. This is going to be our weightlifting exercise. All right. Resistive exercise refers to any exercise where a muscle group is required to bear weight. Okay, and that weight can be anything. Resistance. Some examples of that: resistive bands or TheraBands. If any of you guys had physical therapy or anything like that, you have probably seen all shapes, varieties, and colors of those. Free weights, little hand weights, dumbbells. Those are good things to use. If you have access to a gym, or maybe you have some piece of equipment at home, some weight machines. Those are also very good things to use. Body weight for a lot of exercises, you can use that instead of using something else, another inanimate object. Now, the recommendations for your resistive exercise: 2 to 3 non-consecutive days per week. All right, we need to focus on that. Each session, they should be about 8 to 12 exercises. That should run you through a good routine of being able to target all the muscles about anywhere in your body, especially the ones you use and don't use. It should take you 15 to 30 minutes. There's no real set time limit on getting your exercise, getting your resistive exercise done. Just make sure that you're thorough. Technique is everything with resistive exercises. Like I said, if you're starting out with that first day, make sure you are doing those exercises correctly, okay? Just make sure you're targeting all those major muscle groups. Make sure you're targeting a lot of small, fine muscles like in your ankle that help you balance, help you walk around. You may notice they may not be functioning quite as well as they used to. You know, we have that age-related muscle loss going on as we get older, and that can inhibit our ability to be able to do a lot of these exercises. Hence why we need to be focusing on them and working on them. And like I said, taking your time, starting small is very important with the resistive exercises. Okay? Flexibility and balance training. All right. Flexibility, it focuses on keeping your muscles elastic, and basically by doing that, you are keeping your range of motion. All right. It's recommended 5 to 7 days per week. Every day, whenever you have time, stretch. Stretch, 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 stretch. Okay? Super important. I've never read a study that says too much stretching is a bad thing. Still haven't seen one. I've been looking and I haven't found one. Okay? We should be doing about 15 to 20 minutes worth. That should get you through about 8 to 10 exercises or so. Again, this is another one you can kind of change up if you're doing it 7 days a week and you're doing 8 to 10 exercises. That ends up being a whole lot of exercises that you could run through. Okay? So make sure that you're changing up what you're doing, stretching everything, try not to leave anything out. You want to be holding each stretch for about 15 to 30 seconds and doing 3 to 4 repetitions per exercise. Now, like I said, the balance exercise here at the end, they haven't been formally introduced yet. They haven't got those to where there's a specific set of guidelines. Make sure that you have something, a wall or a chair, podium if you have a podium in your house. Make sure you got something to hold on to. Rails up and down steps, especially if you have a short set of steps, maybe in from the garage, somewhere like that you can do these things safely. And hang on and challenge your balance. There's plenty of resources here at the hospital. We have a medically supervised exercise program that I work with, and you got certified healthcare professionals there. We've got nurses, respiratory therapists, exercise specialists. We've got a mental health counselor over there. We've got a little bit of everything. Our care program, like I was saying before, we offer that oncology rehab. That's what the care program is. Cancer-associated rehabilitation exercise. We've got that. Anybody that gets treatment here at Alamance Regional Cancer Center, that program is free to them. Okay, they got to come a couple times a week, see us for about an hour and a half, and we work on their exercise. Send referrals out to massage therapy and medical nutrition therapy is offered in our department. We've just got a lot of stuff here. Silver Sneakers is kind of a new thing. Some of the insurance companies are starting to pick this program up. They're actually paying for your dues, like the YMCA, for example. You can go there, they're certified through Silver Sneakers, and all you do is carry your insurance card in there and show it to them and ask them if they cover that program, and they'll check on it for you and see if they do. And if they do, your dues are paid at the Y. Okay, it's something that the insurance companies are starting to do, I guess, preventative maintenance. If you hadn't checked on that, that's a very, very good place to start. I always recommend that to any of my rehabbers who come over. To recap, there are many things that you need to do to maintain a healthy lifestyle. All those risk factors that we need to modify, you need to be doing that. And exercise alone can't fix it all, but it's a good place to start. Like I said, it's one of the easier ones that you can change. Okay? And always have that plan set and set realistic goals when you get ready to start. Don't just dive in and hope you're doing the right thing. Again, that's setting yourself up for failure. Don't be afraid. Don't ever be afraid to ask for help from anybody. Okay? And if you don't know where to get it, somebody does. There's bound to be somebody in your family that knows where to refer you to. Okay? And most importantly, you got to have fun with your exercise. If you're not having fun, you're probably not doing it right, and you're going to quit. And you don't want to do that. That's a lot of hard work that you're going to put in, at least for the first little bit. You don't want to give that up, just at the snap of a finger because you don't feel like it's working for you. Make sure that you try all outlets